Hi, I'm Mike Schuh, and I'm here to talk a little bit about pharmacogenomics. It can be an integral tool for individualized medication management. Individualized medicine is a new, exciting area of medicine that I think that all pharmacists could and should be involved with. I think we're all going to be involved whether we like it or not. So let me define pharmacogenomics, or PGX, for us. It's a study of how genes affect a person's response to drugs. It's a relatively new field that combines pharmacology, the science of drugs, with genomics, the study of genes and their functions. With regard to the enzymes and the proteins involved in this, these are usually your cytochrome P450 enzymes in your liver and your intestinal tract, but it can also be other proteins, other enzymes. So we all know that if you take a medication that for the same condition, you're going to get a desired response, which is what we really want from the medication, but we can also get toxic side effects, or we can get no response at all. And this is individual genetic variation in many cases, especially when it comes to CYP enzymes and other proteins in our body that metabolize medications. So pharmacogenomics, or PGX testing, it can help explain whether a medication may be effective. It might explain what the best dose of the medication is, or the likelihood of serious side effects. It can't really explain drug allergies, drug-drug interactions, drug-food interactions, or drug-drug gene interactions. You always have to have a clinical evaluation with a clinician, which can be a pharmacist, in correlation with the test results. There is a continuum under which we metabolize medications. In the middle, we have the normal or the wild type or extensive type metabolizers. That would yield the expected result from most of these drug-gene interactions, but you can have rapid all the way to ultra-rapid. By the same token, you can go all the way phenotypically to the left side of the screen, and you can have intermediate or poor metabolism in medications. If it's an active medication and you're an intermediate or poor metabolizer, you're more likely to have side effects from the medication. If you're rapid or ultra-rapid with an active medication, you're more likely to not have any effect from an active drug. If it's a prodrug, the results are the opposite. So we have to think a little bit differently with these. Pharmacists have the most training to take care of these types of patients that have had pharmacogenomics testing and reporting. We have the pharmacology, we have the medicinal chemistry, the pharmaceutics, the pharmacoeconomics, the biochemistry, all of these things we all took in school, and we can utilize them in this science. We've all had this basic training, and it's really more a different kind of application of this training in pharmacogenomics and individualized medicine. Pretty easy process. The labs are ordered by a practitioner of some kind or provider. The labs are processed, reports are generated, and the patient is consulted with, usually by a pharmacist. PGX is the future of individualized medication management. Pharmacists have the training to own this science. PGX can be applied every day in clinical practice in most practice settings, and it's synergistic with these practices, among others: polypharmacy, psychiatry, oncology, and others. Potential for the use of this in private practice is very real. One can use this in a community pharmacy, just like they can any other MTM type service. So go ahead and get the training.